So advancement flaps. Lots of variations of a theme here. We've got single advancements, A to T's, H plasties, lateral advancement, island pedicles is the sort of group we're going to go through here. So I'll show you some of these. So lesion on the forehead, and it was tight. So that was what we had to cut off to get rid of this little SCC. And as I started pushing and pulling, how's it going to do an ellipse? I was going to try to do a horizontal ellipse. Okay, it's up high enough that it wasn't going to pull the eyebrow too much, but as I was pushing and pulling on his forehead, it wasn't moving enough to close. Then I looked at the idea of can I do it a different way to make it move. It was going to pull up too much there. So I couldn't find a nice way of making this lesion close with an ellipse. So I then looked at what's my options, and I've ended up doing an advancement from his temple. So the looser skin was down around the temple. I've moved that up to fill up the hole. So that's a single advancement flap going up there. This one on the ear is the same thing, but it's around a corner. So if we look at that, I've moved an island of skin forward. Here, I'm moving an island of skin up. I'm stealing some stuff from his earlobe, because again, lots of lovely loose skin. So here's the tumour. And you can see not just the ulcerated part, but the tumour lump around it. That's the actual size of it. And here's my markings to move the skin up on the anterior side. Here's my markings for moving the skin up on the posterior side. Now, so if you can imagine if you folded this out, this would look the same as up on the forehead. We're moving a piece of skin forward. So helical advancement is really just a single stage advancement like on the forehead, just it's around a corner of the ear. That's it sewn up there. Now, one thing with these is as you move things around a convex surface, they tend to dive in when you're joining the two edges together. So convex surfaces can cause some problems in distorting things around it. So often I use a vertical mattress to join the two ends together, just to lift up the skin there to get a better closure. A lateral advancement, again, I designed the ellipse up and down on the cheek, but as the tip of the ellipse was going up high, it was getting too much involved in the eyelid. So rather than going onto the eyelid, I used that line between his eyelid and his cheek and moved it sideways. So in my designing, I was looking at possibly doing an A to T, but as I moved it all around, I didn't actually use that medial limb. So the little line next to his nose wasn't used. All I did was move the skin from the outside. As I've done that, I've closed it that way. So I've moved the skin laterally across. Here on a lack of eyebrow, so again, a horizontal ellipse here was going to pull on the eyelid too much. A vertical ellipse, suddenly the ellipse goes into the eye. So in this one we end up doing an A to T, where I've got half of the ellipse up the top, and then I've diverted it off to the side to be able to move the skin, and effectively you end up moving the skin laterally from both sides to look like that. Another one here, little BCC on the forehead, which when closed looked like that because the ellipse up and down was going to be too far down into onto her eye, and the ellipse across was going to lift up things too much.